Good morning. My name is Harrison Pierce. I'm the Chairman of Health and Human Services. Thank you for attending this morning. Our Zoom sessions continue. In terms of the agenda, at the request of the First Selectman, we are going to bump our new business, which is commission, election reappointment, et cetera, to the number one item. And I don't know if Kevin is on or
I don't
not. He's not
see.
on as of yet.
Kevin
Is
is on vacation.
Yeah, he's not in New Canaan. We'll
Lucky
we'll
guy.
we'll be politically correct and say he's not in New Canaan. All right, let's, we will come back to that then. So the next item on the agenda is the approval of the minutes and the approval of the 2022 calendar.
I'd make a motion, Russ Barksdale, a member of this committee, to approve the minutes and the calendar.
Tom Ferguson, second.
Thank you. All in favor?
Aye.
Aye. Thank you. And Alyssa, thank you for the work. And Enza for the calendar. Next item on the agenda is the reports, Health Department, number one, Jen.
Hello, everyone. So
Hello,
Jen Eielson, Director of Health. So we'll start with vaccine data updated as of last week. Ages 5 to 11 with at least one dose, we're at 61.46%. Ages 12 to 17, we're at 100%. 18 to 24, 100%. 25 to 44, 100%. 45 to 64, 95.48%. 65 and over, we're at 100%. The number fully vaccinated at 16,233, or 80.23% of our population. Percent of total population with at least one dose, 94.44%. The health department's administered 21,138 doses to date. December was a very, very busy month for us, obviously. We held 15 clinics in December. Last night, we held another pediatric 5 to 11-year-old clinic, had another 107 kids. Today, DPH will be announcing they approved the 12 to 17 for boosters. So 12 to 15, in addition to the 16 and 17, it's already approved. So in anticipation of that, Dr. Lutzy and I are once again partnering up. We're going to hold a big clinic at the high school next Wednesday for ages 12 to 17 of the New Canaan Public School kids and any New Canaan resident child. Dr. Lutzy will be sending that out sometime today. It'll probably be in the outcall tonight. They'll be at the high school. And then we have regular booster clinics. Today's booster clinic is already full, and today, because of the expansion, if the 12-year-olds are signed up, they are able to get their booster today. So that's good news, and a lot of anxious parents are happy about that. Testing, we did a lot of rapid testing in December, especially the last week or two with Christmas and New Year's. So in December alone, we conducted 649 tests, 104 are positive for 16.02 positivity rate. PCR tests, thanks again to Waveney for helping with that. We did 587, 46 positive for 7.84% positivity. But I will note the last week of December with the PCR testing, the 28th and the 30th, our positivity rate was 17.58%, 29 out of 165 positive. So it's trending like the rapid tests. Our positivity rate is going up and up and up as the case rates go up. And speaking of case rates, so this week I forgot the exact number we're at, but we're over 250 again. Of those, and just to be clear, these are confirmed laboratory state reported cases. These are not home test cases. So we realize the numbers are going to be much higher, you know? But that's just the way it is. The same thing with the breakthrough cases. We realize that number is probably much higher because of at-home test kits. And what people need to understand is too, if you have one dose in you, like a lot of the young children, and you become positive, that's not a breakthrough case. You have to be fully vaccinated and 14 days to be a breakthrough case. So we get a lot of questions about that. So just be cognizant of the data that now you're going to have underreporting, but also on the flip side, because you're not getting the negative home tests in the state data, the positivity rate is sky high because it doesn't have a lot of the negatives to offset it. So, but DPH continues to focus on hospital data as the primary force, which the hospitalization rates are going up. Dr. Reed sends me daily reports for Stanford Hospital, and they are ticking up daily. So it is important that people, you know, do still be mindful and take this, you know, seriously.
Jen, do
And,
we have a current read on Stanford and Norwalk Hospital?
Yeah, Dr. Reed, like I said, sends me on Stanford Hospital daily. And yesterday, I believe it, this, I don't want to say it without looking at the email, because then I'll be rude.
I
But
have
no,
the number, Jen.
you,
Yeah, so I spoke to Dr. Reed yesterday and he said the number was 75. And then he texted me and said, no, that was the day before. It was now 91. So that's what's happening within a day.
91, but 14 in the ICU. So that's important to note too. And the last he had heard, the 14 in the ICU were unvaccinated. But even that number is now creeping the opposite direction. I think the governor reported yesterday, 68, 69% of those hospitalized are unvaccinated. So it is important that not only people get vaccinated, but you also get your boosters, you know. Our regular job, restaurant relicensing, we had 7 outstanding licenses on Monday that Chris went to shut down. So they managed to get us a payment on the spot. So we're all set with that. Licensing's complete. Hallelujah. Building permits were down in the month of December, which again, another welcome relief. Septic soil testing permits and plan review all continue to be steady. So that continues to not slow down because they're trying to beat the winter freeze to get everything in. So we'll continue on trudging along. And just, I want to thank Bethany and Enza for all their help in helping me and my staff, because we have been underwater for weeks now. So it's been great to have them, and Jill from the fire marshal's office, and Anna, and a lot of people have been pulling in to help us. So it's been great. Thank you, guys.
Thank you.
Thank you, Jen.
Good question. When do we start counting fully vaccinated as being both the first vaccination as well as the booster? Because we're hearing more and more from the state that is now going to be the changing definition. So have you heard anything there? And
Well, the CDC hasn't officially done it, but if you read their updated CDC guidance for isolation and quarantine, they kind of snuck in there. If you don't have the booster, then you have to quarantine if you're exposed to a positive case. So if you have your 2 doses, before it was if you were exposed 2 doses, you don't need to quarantine. Now they've revised that to say you only don't need to quarantine if you have the booster. So I think that's step 1 towards where we're headed. That's why Brian and I are really going to be pushing the booster clinic of the 12 to 17-year-olds, because we don't want the high school and Saks being wiped out for quarantining.
I have a question, Jen.
I think that's an important distinction that needs to be made public, because I'm hearing the same from our hospitals that almost 40% of the hospitalizations right now are breakthrough cases fully vaccinated as their definition of fully vaccinated, but not boosted. So I think that is going to be a number that we need to track.
I have a question, Jen. Am
Yep.
I on?
Yep, we can hear you.
Okay. Question is on the latest on the self-tests and whether they made the airplane from the West Coast, whether they're.
Oh, do we need to talk? I had nothing to do with that fiasco, thank God. No, the state really bumbled that one very badly. And they did make it on the airplane. We got a significantly reduced allocation. And those that had signed up on the Sign Up Genius were notified. They picked them up at Lapham through a drive-through. CERT did great with the drive-through pickup. And then a limited number from that, we had kept aside for the vulnerable population. So Bethany's group of seniors, you know, maybe on the lower income side, we were cognizant to keep some of that, but we have not heard of us getting another shipment. Some
Okay.
other towns got second shipments. We did not. The schools did get their own shipment. So Brian and the public schools have to decide how they're going to distribute their home kits, how many to staff, how many to students, and what the criteria is for that.
Okay, but so for the time being, we could assume that average Joe citizen buys at the drugstores or any of the other public testing places. Is that correct?
Yeah, I mean, I went last night on Amazon and bought some for my mom. I mean, they are readily available. They just might not be in the Walgreens shelf right now, but.
Okay, thank you.
I had
Also
a question.
Going back to the ICU hospitalizations, do we know what percentage of capacity the local ICUs are at?
It's in the web EOC that well, directors of health and emergency management can look at. So then they just color code it. So right now, like Stanford is, not showing any, that they're strained or over surge capacity is what they call it. But, obviously when you have this volume of cases, just statistically speaking, when you're dealing with this number, even a small fraction that ends up in a hospital is going to create a problem. So they are very cognizant of it. And I'm sure Russ is going to end up getting them dumped into nursing homes again because, of what happened last time. You have too many people, you need to get them somewhere. And that's where the concern with all this keeps coming in.
Hi, my name is Kim Norton. Jen, I'm a member of town council, co-chairing this subcommittee with Penny. I had a question about that data. Are there any children in the ICU that we know of?
Well, that's where the problem comes in, because you don't get this real colored what their underlying conditions, their ages, blah, blah, blah. We know of kids in the hospital, but they're in the hospital for other things that test positive, like a lot of pediatric psych issues in the hospitals right now. Unfortunately, that's a whole pandemic in itself right now. So, but no, we don't have that granular data that we all want and we all want to know. I mean, maybe Harrison on the inside track might get something at Norwalk Hospital.
Yeah, well, Kim, the children who need an ICU are not being hospitalized at Norwalk, Stanford, or Greenwich. They're going to Yale or Columbia or other tertiary care medical centers. And the numbers of children being admitted to the hospital has increased significantly, and that would be the ICU also. Although, relatively speaking, kids fare better than adults with this disease, at least to date. Just a little bit more info on the local COVID scenario. So Norwalk Hospital on Tuesday had 50 COVID patients in the hospital compared to a year ago when they had 100. And about half the patients in the hospital, and probably holds for a number of hospitals, are COVID patients. The Omicron, as you've heard, it's 90% of what's out there in Connecticut and New York. In terms of as Russ mentioned, whether you're vaccinated ×2 or received the booster to be quote fully vaccinated unquote. The third dose prevents about 75%, it's 75% effective against hospitalization, where if you only have 2, it's about 30%. Those are the latest numbers that I saw. And what are the hospitals doing? The monoclonal antibodies, which were Regeneron and a Lilly product, are not effective with this Omicron. So the only monoclonal antibody that's effective is coming from GlaxoSmithKline, and that is the hospitals, at least in the New Van system, have access to that. I presume all of them do. And then there are the antivirals, which, you know, the Pfizer, which supposedly has about a 90% effectiveness. And these things have to be given early, and the earlier the better. And after 5 days, the effectiveness drops significantly. The Merck product is about 30% effective in that same time frame. So I think that's it for health. Thank you, Jen. And Kevin, welcome. I think we'll accelerate. We'll go back to our new business commission, appointment, reappointment, election of officers.
Morning, Harrison. I had a little technical difficulty getting on. Can you hear me?
Yes.
Yeah.
So anyway, I have a hard stop at 9:15. So if I could conduct the officer election first, I would like to do that. First of all, I'd like to thank you, Harrison, for unbelievable work this past year, both with respect to chairing this commission, but also with all your vaccinations. Have you counted up the total number of vaccinations you did?
No, I can't count that high.
But anyway, I think you've done a terrific job, and I appreciate all the work of all the commission members here. So with that, I would ask for nominations for chairman for the ensuing calendar year.
I would nominate Harrison for another term.
Do I have a second?
Second,
Second,
Tom Ferguson, second. Do I have any other nominations?
I'm going off video and muting myself.
All right. All in favor of electing Harrison to another term as chairman?
aye.
I,
I guess if it's unanimous, we don't have to take a poll with a virtual
Right.
virtual meeting, I guess. So any negative votes? Any
Nope.
abstentions? So it is unanimous. Congratulations, Harrison. Do I have a nomination for secretary?
Alyssa McKenzie,
Tom
I
Ferguson
second Alyssa McKenzie.
nominates Alyssa McKenzie. Do I have a second?
Second.
Second.
Elise Meyer, I second.
Okay, I'll take Jim Lisher's second. And then any further nominations for secretary? Hearing none. All in favor of Alyssa as secretary for the next calendar year?
aye.
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 Any negative? Any abstentions? So that is unanimous. All right, thank you. And once again, thank you for your service on this commission. It's been a challenging year, and it continues to be a challenging year, but I also want to recognize both Bethany staff and Jen's staff for an amazing job, both on the health and human services side. And we're getting through this together, but it's been an incredible effort by the staff, and I really appreciate all the work they do. So,
And Kevin, the only one who's up for a reappointment is really Jen Laddick, who took Judy Dunn's place. So, and Jen is very interested in continuing, and we're very happy that she's going to continue.
right, and I think we have 2 vacancies to fill, which we need to get some nominations for those.
Yeah, the bylaws have a position of 9 on the Health and Human Services Commission. We have 7 moving forward. So if anyone knows of any outstanding candidates, please bring them to our attention and we'll move forward. Thank you, Kevin.
You're welcome, and have a good meeting. I'm going to only stay for a few more minutes. Thank you.
Next item on the agenda, Bethany, Human Services.
Hi, everybody. Bethany Zorro, New Canaan Human Services Director. So our client base, we remain the same with about approximately 350 clients. Our domestic violence cases for the quarter are down 6. Well, we had 6 cases in the first quarter. In this quarter, last quarter, we had 11 cases. So we are down from 11 to 6. We have remained constant in the number of referrals. We received 45 referrals first quarter, which is July, August, September. And then this quarter, October, November, December, we've received the same, about 45 referrals. These are really behavioral health issues. So definitely they're very complicated, and Marcy and Jackie are doing an unbelievable job in terms of navigating and helping the families and individuals. The phone calls, always have doubled. Last quarter, 1,500 phone calls compared to 2,400. So during the holiday seasons, everything gets an uptick. Food pantry, we doubled in participation. We had 360 participants first quarter, second quarter, 800. This is very normal. And the Lapham Schoolhouse, we have the same number of programs, but our participation, we do have a double involvement, about 150, 160 clients, people participating in these programs. And home visits have doubled. We're up to about 40 home visits. Telehealth participation remains constant. About 25 participants are inputting. I do have many more clients, but they are comfortable and will call me if they have an issue, but otherwise we have 25 putting in their vitals. Holiday program, 75 children. The parents or guardians received $50 gift cards for them. Thank you to the public, and including the New Canaan moms and organizations donating $50 gift cards. Flu vaccine, we are out of vaccine. We've given 370 flu vaccine shots, and Enza will be submitting to Medicare. And that's a whole nother progress that will take place starting this month. Our assistance is way down in terms of monetary. We did 11,000 last quarter. This quarter, we've done 1,000. We expect to see an uptick as the children tax credits have stopped. And right now it is a quiet time of year historically that people are asking for money. What else? We continue to assist the health department, and we are so happy that we can be of assistance. Anything from inputting Jen to serving at the clinics. And so we continue that support. We participated in the CERT mass dispensing of the take-home kits. The 4 of us at Human Services, we helped with the passing out, and that went beautifully. CERT did an amazing job. Blood pressure clinics, right now they're on hold at Lapham, but Schoolhouse we're continuing. And that's about it. Any questions?
I have a question. Did we have any situations where people got a flu vaccination and a COVID vaccination at the same time?
So
see.
CDC, says that it is all right to do, and given the approval, I did do a couple of people.
Okay.
They came in and got the flu, and they said they were going over to Jen's to get the.
Good.
Yeah, so they did.
Okay, thanks.
Bethany, do you want to just go over the budget?
We can do the budget. So I sent that budget late last night. Basically, we are staying the same with the question of the grants. The grants, we thought we were going to receive a $90,000 grant request from Kids in Crisis. They gave us an $85,000 request. As a result, I think decisions need to be made. There's an extra $5,000 to be put somewhere. My recommendation is we put it in the community program mental wellness where we have $5,000 with mental health chronic issue. It is an epidemic, the way Jen described it. I suggest we put the 5,000 in that category and use it for public service announcements and help and guidance for the community as we navigate through this mental health crisis. That would still maintain the 100.
I'd second that.
So, yeah, someone's got to, I cannot.
Yeah, I'll
can't
make the
vote for it.
motion. Russ Barksdale, I'll make the motion to make that transition and to use some of that money for public education. I think becoming fully vaccinated to include the booster, I think needs to be part of that as well. Overall, understanding the impact of mental health and behavioral health issues on our community during this protracted, long period of time.
Wondering if there's ever been any kind of speakers on mental health and COVID. I noticed that there's going to be a prayer session, an interdenominational prayer session with all the clergy, and there was a lot of talk about people feeling uncertain and anxious. And has there been any kind of situation where people could come and listen to like an expert on how mental health is affected by all this uncertainty and COVID and things like that?
This is Jackie, Youth
Yeah,
and
I
Family
should-
Services Coordinator.
Thank you.
New Canaan Cares has tirelessly done talks like on this and always looking to do more. I believe in my newsletter, they have something that might be mid-January. We're also, our New Canaan Abuse Prevention Partnership is partnering with Staying Put. I think CARES is on that as well. The Domestic Violence Crisis Center, they're doing a program in February for seniors and caregivers, but the topic would cover like but a lot of that stuff as well, the mental health piece, because I think it affects the families, it affects the parents, the kids. I mean, but yes, I mean, I'm just naming New Canaan Cares, but I know that I'm sure Live Girl has done stuff on this topic. There have been like multiple, the PTCs, PFAs have brought in speakers. So yes, but I mean, there's always room to do more. If anyone knows of a speaker, we're always looking to find someone new. So but definitely, yes, I think it's important because we're in the same cycle. I mean, it's like, I think, did all of you think we'd be out of this? We did, but.
Yeah,
So,
I get a lot of comments from parents who have, tweens and teenagers, and they're just feeling, the kids just are having a lot of issues with this, as well as the parents. And it would be great to get the message coming from the town. There are all these, other groups in town, and I read all those things and go to them as well. But to have, just like we have clinics run by the town, could there be a mental health speaker that would be coming from the town, so to speak, so that it could be I think it would just make people feel better in terms of addressing all this confusion and anxiety that's out there. If that's possible, I'd be happy to look into anyone that's an expert in this. I could do some research and get back to Bethany or.
Yeah, and we'll see in terms of partnering, maybe we can partner. We don't want to duplicate, but yeah,
Right.
Jackie, I know you're up on the speakers and things. That is one of the reasons we do New Canaan Cares. We do give them, and they requested $18,000 for this year from us, which you've granted. Domestic violence, we've given 5,000. But at the same time, yeah, there's some partnering we can do in terms of getting out for a public service. But
We need
usually
to stay working with the Let's Talk About It plan, which is run by the New Canaan Foundation, of which the commission's 6 programs we produced in 2020 are still there on Channel 79 and on YouTube. And they add additional speakers all the time to that. So yeah, I've lost track for the last couple of months since I've been on the side. But I would presume they're going to continue the Let's Talk About It as an umbrella organization over the next 12 months minimally, because the problem is not going away.
I think we all agree it's actually getting worse. I mean, if you look at, you guys, your teams have been tracking domestic violence and substance abuse issues and problems in schools and acting out and things of that nature. So maybe we need to, public service announcements and things of that nature to publicize that and help direct some of the residents in the community to some of these programs that are already established. I think that could be a good partnership.
Yeah, that's what I think in terms of, how we ran the seasonal during the holidays for Don't Drink and Drive. Maybe we could do something, if you feel you want to take this direction, where we do find out, what all the upcoming speakers are. It's probably going to be Zoom more than anything, but to post that in terms of social media, supporting the town, human services and the town's and health department, supporting these programs and speakers that are already being paid for and supported. And it's great to do this for the community and the organizations that we work with. So
I
if
have
we,
a question. Has it ever been done with the New Canaan Public Schools?
what the Jackie has a
Are you-
grant that she works with.
Are you talking about a partnership with them on a topic like this? Is that what
Just
you mean?
having like a speaker for the kids or for the parents that was sponsored by New Canaan Public Schools addressing, there's academic issues with COVID, there's mental health issues that is affecting children's learning and things like that.
Yeah, I mean, I think, definitely they do. I mean, they might not market it directly that says mental health, but when we were able to get in the school, we could do a lot of stuff like that too. If I get your email, I can send you some upcoming things that are happening because, just as Jim mentioned, I'm totally was forgetting about our Let's Talk About It podcast. We actually have one that needs to be edited. That was, the panel was Bonnie Rumley, who's our head of our EMS, and she's a therapist. She's talking about that. And then it was a colleague from Silver Hill also talking about this for parents. Like I said, I don't think it's been edited yet. Bob Doran is great and he's been doing this all for us. So I think it was recorded in October and then I had checked back on it. So but I can definitely let you know about that. But again, I'll let you know about future things because there are a ton happening on these topics. And yes, the school is definitely on board with this message for sure, because they're seeing it day in and day out.
I think those are good ideas and we will pursue them in some fashion. Thank you, Bethany.
Yes.
Marcy, I guess you're next on the agenda. Adult and Senior Services.
Morning, I am Marcy Rand, the Adult and Senior Services Coordinator. Energy assistance applications are continuing, as are calls for referrals for home care. And we are having steady calls on new to Medicare questions, as well as some mental health calls with Protective Services and the Police Department. I am tagging along on Bethany's blood pressure clinics at Schoolhouse to keep a constant face to the Schoolhouse residents so they know me and feel comfortable with me. Coffee with a Cop last month had 15 people attend and it's been fantastic. And unfortunately, as we've all been talking, COVID has raised its ugly head again. And we are not going to be having it in January. We will be back in action, I hope, both fingers crossed, in February. And our Life Reimagined group last month had 12 people attend. And I will have to talk to Aggie about if we should have it in person, if we should have a Zoom group this month, or if we should just postpone and move it to February. But that's been fantastic. And it's been a steady group of people who've been coming. So we're thrilled. And I'm continuing to just sort of casually go over there on Wednesdays. And just, say hello to people and just make myself known.
Sounds great. Thank you, Marcy.
Yep.
Jackie, Youth and Family Services.
I'll announce myself again in case no one heard me before, but it's Jackie DeLuey. I'm the Youth and Family Services Coordinator for the town. And as you've heard, yes, although Bethany was saying domestic violence numbers go down, they've gone down just over these holiday months, which sometimes we see an uptick around the holidays because families are getting together, maybe kids are home from college. But what I will say is on the back end, we are working with families before they have to call the police. So, those numbers, we've gotten a lot more referrals and are able to work with those families, which is a good thing. I mean, we love them to utilize the police if they need to, if there's a safety issue or anything like that. And of course, our police are very knowledgeable in these areas. So it's great, but we'd like them to get to the counseling first or put a safety plan in before they have to utilize the police. So that is good news when we can see that happening directly. December, we talked in the beginning of the month. I have fuel applications trickling in, but people can apply to like April, the end of April, maybe even beginning of May. And Canaan Parish is now, everyone's moved in, and those have all become now Eversource gas clients. So they had not been able to apply before, so they will be able to apply now. So as long as they have those gas bills, they can apply as well to get some of that funding. So I think Marcy and I will definitely see more families and individuals needing to apply for that. So that's great. Although they acquired another bill, at least they can get some assistance for it, which is great. Definitely, I still am constantly talking with people that need referrals for counseling. And I found that I've had to give even more names because a lot of these therapists don't, they have wait lists. Even with Zoom, you'd think that, they have more time because they don't have maybe the commute time, but and especially when kids need to see people in the afternoon or evening, a lot of them don't work on the weekends. Those times are eaten up very quickly. So that, but definitely always working on making sure people have those referrals. The police has been wonderful. If we should probably have her on, but Nicole Vertuli is an officer for the New Canaan Police Department. She's assigned to oversee Millport and Canaan Parish residents as well, just to see if they have any needs. And she just became, I think, the community downtown cop now. I think those roles had switched. But she is working with Marcy and I all the time on referring families. So in addition to the domestic violence calls, the police tell us about minors and their families if there's situations. Like we can't see reports on that because that's confidential information, but they get us involved. So I had 2 in December, and now I've already had 2 in January, and it's only the 6th. But that's great because now these families know about us, that are new to needing help. And so we'll have to definitely have you say hello to her. She's fantastic. I wanted to say this first and then I jumped around, but a big shout out to Alyssa McKenzie, who is always in contact with us to come up with any needs that we have. I mean, she thinks outside the box, but she contacted me in 3 minutes when that rapid test kit sign up like that filled up in 3 minutes. So obviously if people didn't have access to a computer at that moment or weren't home or any of those families, especially families or individuals that we're working with that don't have the resources to go out and get those and you can't find them. She donated a couple from her own private stock and brought them to our office on the 30th. And we were able to distribute to some families. And then she also put a shout out on Facebook Moms to see if any of those people could pick up some kits. And we did get some dropped off, which is great. And now, as Bethany mentioned, we have a little bit of stock that from the delivery we got from out west. So that's great. But she did this in a moment's notice and she's always doing that. So thank you, Alyssa. Honestly, I can't thank you enough. And it was great to work with Stuart and his CERT team. They were real professionals. So happy to help them in any way. I'm sure there's more that I'm missing. Does anyone have any questions for me or?
Jackie, I do want to say the CERT, it was really interesting. Human Services has never worked with CERT before. And it was great. We were out there, we had our CERT vests or jackets on with them, and it was great. And once again, it's one more organization in town that,
Right.
that we can partner with.
Yeah.
And we have contacts there now. And I love it. And this is why Human Services is here, is we are a resource place. We don't do everything, but we can find the organizations and work with them, those that do. So that was a great addition to our resources. So.
Yeah. If anyone has any questions, Harrison, I'll just lastly mention that a family you were concerned with, we are in help, assisting and helping them. So it was a family you would come in before the new year. So just so you know that that's definitely happening. So I know that would make you feel better.
I have a question, Jack.
Sure.
I saw somewhere where the police department was collecting coats. We have in the past collected coats at Human Service. Are we going to do that again? Or is that?
So
me?
that effort, actually, they did that for us, and those got distributed at our food pantry. So I think there was a distribution. Bethany, correct me if I know we gave some out at our December 22nd food pantry. It might have been the one before that. We
Yeah, we
also
did
got
an
gloves
early-
and hats. Yeah, that
This
were given out.
coat drive happened early in November. And so we've been at each food pantry. We've had the racks there with the coats on it. So we
Ah,
did
great.
partner with the police department.
Yeah.
And they definitely, the community followed through with all the coats, and we will be doing hats and mittens probably in January. Once again, New Canaan moms are very involved, and they want a project to do. NCL is involved, so we will have something working with them in January. So for all the hats and mittens that are lost, one of each or whatever, these kids have a chance to get some fresh, warm weather. Cold weather gear.
Are we working with the Council of Churches on a going basis for things like mittens and caps and coats?
Working with them in regards to?
The Council of Churches, which has all of the clergy of all the churches.
Yeah, well, working with them in regards to,
Well,
I'm
in
sorry,
terms
yeah.
of when you have a collection of caps, mittens, coats.
and
Or
when we're
food,
looking for
or
them,
food.
they contact us when they want to do a program.
Okay,
So we're here. If you would like to do something, they know to contact us.
all right.
I do not go out to the public saying, or to organizations saying, they know that, if we need help, if we needed something short-term notice, yes, we would definitely reach out to them with our community outreach team.
Yeah.
Other than that, they do contact us if there's a group like the youth group. Somebody wants to do a good deed, they come to us. Boy Scouts, they come to us if they need to do something. So
Okay.
I do not push out that information. We don't have enough. We would be doing that all year long, and some of these are very seasonal. So we're working with them, and they come back year to year after year wanting to do the same thing. And there are these programs that they run out of their faith-based communities or organizations or sports clubs, very, very involved. And once they do it, they do come back and want to do it every year. So
Great. Thank you.
we're so
Just wait to
lucky.
piggyback off that, Jim. Funny enough, Bethany, right? We have too many organizations calling us that want to do stuff that we might have to do that if we were ever in we didn't have anyone, but NCL is always a leader in these areas to want to do these programs for us. I mean, I am coming up with other options for them all the time if we don't have the direct need because someone's already taken care of it for us. I had a group, I think it was the Mormon church, a woman called me and she had 15 teenage girls, and I was like, oh, maybe they could help out at the Kiwanis tree thing, because I honestly didn't have an effort that they wanted to actually physically do something, which with COVID too, I was like, oh, it's a little risky to, have that outreach somewhere. But anyway, it's great. We haven't had to do that. So
Yeah, it's a great problem, great
Yeah.
problem to have. But we have just-in-time outreach, on the media saying what we need. Like we needed the test kits, the at-home test kits for some of our clients. And oh my gosh, I mean, Alyssa jumped on that, and then the moms were coming in, dropping off the kits. So I just, once again, it is a good question, Jim. And we don't have that problem of having to do that. So.
Good.
This is Tom. I have a question for Bethany and her staff or Jen. Do you guys have enough resources to do your job? It sounds like you have plenty of work. How are we in terms of resources and people?
Question here. Our resource Rolodex is strong, and with Marcy, Enza, and Jackie, when we need to find something, that's what human services is. We'll find that resource if there's something lacking. We're really good at just trying to navigate going online, but we're okay, human services.
Okay.
Thank you.
Thank you, Jackie. Next item, old business, kids in crisis. They are still searching for a counselor at Saks. To date, no success. Reasons are COVID, number one, time of year, number two. They are going to increase the salary for the position by $5,000, and that's going out in the advertising as of January. So we're pretty much status quo in terms of that. The American Rescue Plan. So town employees have been compensated somewhat via the American Rescue Plan. Board of Education also for teachers and all those associated with the educational system. There is a list that the town has that is quite large. And I think it's all under discussion ongoing. I did speak to our first selectman about the relationship with Silver Hill, which he wants to continue. And to just backtrack a little bit, when we talk about mental health and the effective academics and approaching this in maybe a broader scale than individual speakers, so with some kind of reach out and maybe let's talk about it is the venue, and if maybe HHS could publicize that, and we can find the right people to address those issues, the effect on kids, the effect on families, not only the academic, but the mental health. I think that's something that's on our near agenda to do. The original thought about Silver Hill was to have a resource for families that couldn't afford the mental health support, be it the psychologist, the therapist, the psychiatrist, whatever, and social workers. And that's still in the offing here. Because as we mentioned this, no one has enough money to pay, and the insurance companies don't cover that area of health like they do other areas. The holiday gifts, it's always a rewarding little afternoon to deliver these gifts. And it's a little eye opener for us too. The staff knows more than we do, but the loneliness out there, and we all delivered 3, and it was, it's always, it reminds you that it's better in the giving than in the receiving. So 3 going out there. One fellow would have loved to talk to, invited me into the living room, have a seat. An hour later, I had to get moving, but he would have talked forever. As an aside, too, very connected to Bethany, and emotionally, these people are very connected to HHS, Marcy, Jackie, the staff, and very much appreciated. And you also see when you do this, the loneliness, which I mentioned, but also, the physical needs and the other kind of stress factors in these people's lives. So it's just, it's an FYI that it's a good thing we do, as small scale as it is, and it's an awareness and just a reminder what HHS really does in the community. And even when Kevin refers to the vaccines, lots of people have been doing that. And we have to look at this community. And I think periodically, yes, this is the next station to heaven, but we've got the RNs that were volunteers and all the time that they put in, the EMS, the same thing. It was, and, HHS doing their little thing, as well as the health department, the hours that they've been working, stretching it out, going to the nurses, the Janet Reed and the nursing supervisor, plus what the nurses have done in terms of contact tracing, nights, weekends, et cetera, without compensation. It's pretty significant. Anything else under new business that anyone wants to mention?
Well, I think Harrison, we're doing a little bit of a disservice as a commission, not spending more time on providing town council and others in the town a sense of priority, if you will, on the American Rescue Plan Act. And I think, yes, Silver Hill is an important issue. Testing kits are important issues. PCR access, antigen test. We all know, going through the cycle where early on the antigen tests were not the gold standard, and we're producing both false positive and false negatives. We're seeing a lot more manufacturers in the discussion right now, and some of the antigens are coming in packages because of the false positives and false negatives. And so we're seeing, as healthcare providers, a lot of that. Hospitals are also, we talk about ICU and what their daily census is, but I don't know if anyone has been into the emergency department of any of our local hospitals recently, but they've been stretched. And so nursing education and trying to recruit nurses into the profession, there's a whole series of things as we as a commission, I think, should be providing some guidance to town council on those priorities. If you look at the U.S. Department of Treasury's website, quote unquote, the coronavirus state and local fiscal recovery funds, or ARPA, provide a substantial infusion of resources to help turn the tide on the pandemic, to address its economic fallout, and lay the foundation for a strong and equitable recovery. That fits within our charter as a commission. And I think we should be giving more attention to providing those priorities and looking at all of the information and data that we have, and providing support to both our selectmen as well as town council on what those priorities should be. Funding objectives that are listed support urgent COVID-19 response efforts to continue to decrease spread of the virus and bring the pandemic under control, and address systemic public health and economic challenges that have contributed to the unequal impact on the pandemic. And certainly you could argue that the senior community in New Canaan has been disproportionately affected. So those are things that, as we talk about as a commission in Health and Human Services, I think we, instead of spending a very short amount of time on that, we should be giving more assistance and support to our elected officials on priority funding. I did not see any priority funding given to our local or town health department, as an example, or local healthcare providers, or ongoing timely and accurate COVID testing, or ongoing behavioral health support. We talk about it, but I did not see any priority funding that was given to those significant areas. So it is fine that we sit through a presentation as a commission, but I think that we also need to look at our charter and our obligation to the town for setting priorities.
I want
I
to
just
build
wanna-
on your comment.
Yeah, I wanted to comment after you. Jim, go ahead.
I was just going to say the ARPA money, that some 6 billion, as I recall, into Hartford is just beginning to be spent. Particularly in Fairfield County and particularly in healthcare, Russ, the Office of Policy finally is beginning to spend, I think it's $70 million over the next 3 years. And so that timing is very important to what you're talking about. We need to figure out how and if and where we're going to participate in that, because it's a substantial amount of money. And I think, what is it, 6 million, Kim, that's coming into the town out of that? So this is we went, as a citizen, we went from several years ago in Connecticut, big borrowing and stealing any nickel we could get. Now we've got a major infusion of money, and healthcare is a major place. Most of the attention is all going to COVID, obviously, but there's a lot more, and particularly the residual from mental health, as we all have pointed out, is going to be with us for a long time. So we need to get ahead of this. And so I just want to second Russ's comment about getting a group together to figure out where and how we can take advantage of this for the town, particularly with Health and Human Service.
Yeah.
Right.
Yeah, I'd like to third Russ's comments in your Jim, right? I don't see your full.
Jim, I'm
list.
sorry,
Yeah, I would like to also support your comments as well. I think that's a terrific idea, and you know, there's both the health component and then the mental health component, and it would be great to have, you know, on some level, this is a trauma to families and to children. And when you look at test scores and reading scores and math scores, they have decreased nationally. And to have some kind of acknowledgement of that and how this affects children's learning, although we've been in person in New Canaan, which is terrific, there are residual effects. So I know Kevin did have some originally had allocated some money to Silver Hill. I don't know who the appropriate provider is, but to have more of like a proactive debriefing of families and children, and you know, to kind of normalize everything, and a way to reorient people towards what is the new normal, and address it in a very proactive way, I think would be great. So Russ, any way that I can help with that, I would be happy to do that. And I think it's a huge priority to see some of that money going to families and children in New Canaan to address that.
Right.
Yeah, I
Yes,
would, this, Tom here, I support Russ 100%. And we need to do this, not just at our meetings, but in between meetings, and focus specifically on ideas that are workable and really make a difference in our health world here. So.
Yeah, as a sidebar to what Russ said, it's when you look at the hospitals, the staffing, the ERs are seeing 40% more patients than they usually do. And every hospital is having a problem with staffing, with staff being sick, et cetera, et cetera. So, but the main suggestion that Russ made is very good, and I think gives us direction about what to do, because this list of the ARPA, you know, the possibilities, I think we could influence that in a very positive direction, closer to what we do in terms of Health and Human Services, the healthcare, the needs, the mental health of this, that, and the other thing. So that was a great suggestion, Russ, and I think we are going to move forward with that, because I think we can have valuable input. And anything else? All right, thank you all again for attending. Our next meeting will be February 3rd, 8:45 a.m. We will be continuing the Zoom, obviously, with these astronomical numbers that we're seeing. Would be great to get back to in person at some point in time, but TBD. And may I have a motion to
Motion
adjourn?
to adjourn, Russ Barksdale.
All in favor? Aye. Thank
All right.
you.
Thank
Stay
you,
healthy.
everyone.
you.
I will
Bye-bye.
stop the recording now.
Thank you, Bethany.